Welcome to Clinically Speaking by EmpiRx Health. I'm Patrick DeCiro, Chief Marketing Officer of EmpiRx Health. We're grateful that you could join us today for the first episode of our new podcast. Clinically Speaking will explore the new ideas, strategies, and innovations that are transforming the world of healthcare. Our particular focus will be on pharmacy care and the significant impact it has on patient health and managing costs. We will be taking a broad view of the issues and opportunities impacting the millions of Americans who rely on private health plans and the organizations that sponsor them. For our first podcast, I'm pleased to welcome Danny Sanchez, the Chief Executive Officer of EmpiRx Health, which sponsors Clinically Speaking. EmpiRx Health was founded more than a decade ago and today is a leading independent mid-market PBM company. Danny has spent his entire career in healthcare with a particular focus on pharmacy care. Prior to joining EmpiRx Health in 2023, Danny worked for more than 15 years in senior leadership roles at Omnicell, the global healthcare technology company. Danny has pharmacy in his blood. He worked as a pharmacy tech to help pay for college, and I also know that he's proud that even his wife is a clinical pharmacist. So welcome to the podcast, Danny.
Thank you, Patrick. Appreciate you having me.
Yeah, so great to have you here. Got a lot to talk about today, and I know it's one of your favorite subjects. So, as I mentioned, you've spent your career in the pharmacy space in one way or another. Why do you believe that the pharmacy industry today, and especially pharmacists themselves, are now at such an historic inflection point in America in terms of the critical role they play for healthcare?
I think that starts with access, and the fact that today primary care is really struggling. And if you look at some of the metrics that are out there, you can see that there's a shortage in primary care, and there's not a good solution to that shortage. And so as consumers are out there and individuals are out there trying to get answers to therapies that they may be put on, prescriptions prescribed, questions about ailments, it's hard to get to that doctor. I mean, myself recently tried to make an appointment to see a physician. It's 4 months out. And so I need answers today. I want to try to, solve my problem now. And the pharmacist is the most accessible healthcare professional out there, and I think that consumers don't often realize the fact that you can go see a pharmacist for free, right?
Yeah.
You can walk in and have a discussion with a healthcare professional at no charge. Often, there's 24-hour pharmacies, so accessible all the time, and interestingly, their license requires them to stop what they're doing and counsel you. And so, they're legally required by their license to actually service you. And I think that's very unique. And there's no other profession that I know of where, I have to provide you consult at no charge whenever you need it, want it. And so I guess what I'm saying is, the situation where we just don't have enough physicians, not enough primary care drives patients somewhere, and that somewhere is our pharmacies.
Yeah, it's really kind of looking like a perfect storm for the pharmacy industry and for healthcare writ large. I mean, I know, Danny, you talk all the time about how during the pandemic, not that long ago, we really found out the importance of pharmacies, right? I mean, the critical role that they played and the trust that they engendered with people across the nation in every neighborhood, every community, because they were the only ones that were open.
That's right. Yeah, and I think we forget. I think as humans we forget how important pharmacists are today and how critical they were during the pandemic. Over the years we've pushed more to pharmacy. I'd say most people get their immunizations at pharmacies now, where before that was done in primary care. But because primary care couldn't handle that volume, it shifted over to the pharmacy. And that's all okay. It's okay to give this type of work to pharmacies because they're trusted and they have the capabilities. But what's not okay is we don't reimburse them fairly for these activities. And that's really the challenge. Because I think that pharmacists, there's no question they want to do more and they want to participate and they want to take the time and engage patients. But because they don't get reimbursed properly, they just can't can't do these activities and stay open as a business, right? And so we've created a situation where we're squeezing them, and not really valuing what they do.
Absolutely. We're going to talk a lot about reimbursement today because that's one of the fundamental issues facing the industry today and one of the biggest challenges for pharmacies and pharmacists. But the one point that I would make here, too, relative to the critical role they play, in pretty much study after study, it's been shown that pharmacists are among the most trusted healthcare professionals. In fact, in a lot of different surveys I've seen, they're the second most trusted healthcare professional just after nurses. So they really do play a very important role. So let me go back to when you joined EmpiRx Health almost 3 years ago now. Um, jumping from a pharmacy technology company, one of the leading ones in the world, and really being steeped in the pharmacy space, both retail and hospital pharmacies. Then you jumped over to the other side, if you will, the PBM industry. And how did that happen? And did you have any reservations going into the PBM space? Because it's no secret to you or anyone in the pharmacy business that PBMs are not exactly the most popular entities with pharmacies.
100%. So the question is, did I have reservations? Absolutely. Right.
Yeah,
PBMs, unfortunately, have a terrible reputation that they've earned. And so when I had the opportunity to look at EmpiRx Health, I did have reservations. But then when I saw the model and realized, like, the EmpiRx Health model, which is an outcomes based model, is the model that should be adopted to go forward. It is putting patients first. It is combating overprescribing. It is combating, pharma's abuse, to push more expensive meds to patients. Like, these are the right things to fight against. And so my reservations were kind of alleviated when I had the opportunity to actually visit EmpiRx and see pharmacists in the hub driving these interventions. And I remember thinking to myself, Patrick, I thought to myself, like, I want this solution for my family. I
yeah,
want a pharmacist in the background looking at what my two young girls are prescribed and my wife is prescribed, and always making sure that we're on the right therapies. I think that it is not obvious to people that you can go and visit, four physicians today for different ailments, and none of them are talking to each other, and now you're prescribed drugs that may be interacting with each other. And, you thought you had your psoriasis solved, and now you're taking another drug for something else that's making that drug not work as well. Who's solving these things for you? Who's looking at this, making sure that your whole health is right? And that's where EmpiRx comes in and helps with that. The other piece to that is, physicians are trying to see as many patients as they can, and kind of solve problems for them. As they're limited in the amount of time they can spend with a patient, and so you're also limited in taking the time and figuring out the right dosing for a patient. That's where our pharmacists can step in and make sure that you're on the right dose of the medication. You're not on the maximum dose, but on the right dose. Right, the more drug you take, the more side effect you have, and so you want to be on the right dose, not on just the max dose, because that's what pharma wants you to be on, and that's what they told the doctor to do.
yeah. Um, isn't it interesting, Danny, that EmpiRx Health was founded on the radical idea of putting pharmacists back in pharmacy care? I mean, it's kind of amazing that really no one else is doing this. I mean, you say all the time that EmpiRx Health, with its pharmacist-led approach, is one of one in the industry. Why do you think no one else is really doing it that way? That really is such a important revolution in the PBM industry.
Yeah, I often say that somewhere along the way, PBMs lost their way,
Yeah,
and that's not unusual when you're driven by profits, right? And you're trying to make a number to make Wall Street happy, and you lost the focus on your job being to manage a pharmacy benefit. I don't think any PBM, exception Empirix, actually manages a benefit. I do think, every PBM out there is avoiding knowing what's going on with the patient in depth, because if you know, then you're required to engage and solve. And so, Empirics employs, 60 plus pharmacists that are driving these interventions and having discussions with physicians and ensuring patients are on the right therapies. Every other PBM out there is not doing that, and they don't want to do that. That's why they have these, 98% plus approval rates on PAs, because they're just letting prescriptions go through. That's not managing a benefit, right? If I'm just rubber stamping every prescription that's coming through and not questioning, is this the right medication for the patient, or oh geez, Danny's on 3 other drugs, this medication isn't going to be very good for him, let me call the doctor and put him on the right drug. Those are good things that should happen. That is what managing a benefit is. But if I want to be, blind to what's happening with the patient so that I'm not accountable, then I'm just thinking about dollars and not really thinking about outcomes. And I don't think that that is truly what a pharmacy benefit management company should be doing.
Yeah, it really comes down to the sort of fundamental business model of the largest legacy PBM companies. So over the last 50 years, they've gone from being, truly healthcare companies and focusing on healthcare issues and concerns, and becoming much more like Wall Street trading firms that are focused on arbitrage driven profits. So, if you look at that sort of core business and operating model of the biggest PBMs today, it's all based on profit, and it's based on driving more drug volume and higher rebates. So that is completely misaligned with the need to manage those costs for their clients, the organizations that sponsor the pharmacy and the health benefits plans, and also on the number one goal, which must be to improve the health and well-being of the patient. So it truly is an outdated business model, but it's even worse than that. It's a anti-competitive and frankly a self-dealing business model, which is hurting community pharmacies, which is hurting healthcare in America. Perhaps you could talk a little bit about how these large PBM companies are really a major threat to community pharmacies because of their operating practices.
Yeah, and it's interesting. So I'll color that in a little bit for sure, but also just take a step back and think through the fact that, as you said, like, this practice has been around for a while. And so not only is it abusive, but they've also trained the industry into that. It's into that abuse, right? And so when you're dealing with employers who are trying to find the best benefit, you know, they're using the wrong measures, right? You have a lot of HR executives who are looking at rebates as a measure of success, right? And it requires a lot of education to retrain these folks to say rebates is not a good thing, right? The more rebate you get means the more volume that was pushed through your employees, and the more volume that pushed through, the more expensive, the more money you paid, right? And so what you should be focused on is net savings. So it's sad that the whole industry has been trained to the drivers that the big three want them trained to. I want you to always look at rebates. I want you to love this rebate check. It's the best thing in the world, versus net savings. That really should be what you employ: net savings and patient outcomes, right? Are you controlling trend on your costs, and are you driving a good outcome for your patients? Those should be the measures that you use. As we think of the industry itself, using these levers such as rebates and spread, it's the only industry that I'm aware of where you control the employer's wallet, but you also set the price and you create that arbitrage. And so they're able to move the dollars in whatever direction they want, and basically spend your money by setting pricing. And so on the network side of things, this is where we hurt community pharmacies, not just community, all pharmacies, really. I mean, we just had, in the last year and a half, we've had 2 huge pharmacy chains, one file bankruptcy, the other one having to go private because of the squeeze that these network contracts are creating. And network contracts are the prices that pharmacies get reimbursed at, for servicing these patients. And every year we pay pharmacies less and less and less. And what that does is it just puts them out of business. And so if you're paying a pharmacy less per prescription filled, that means that they have to drive more volume. They have to fill more prescriptions to keep their doors open. Oh, and when they fill more prescriptions, it takes them away from the other things we want them to do, right? We want them to counsel patients. We want them to spend the time to educate patients on their therapies, but because they have to fill more prescriptions, they don't have the time to do these other tasks, right? And so that is what's really squeezing the profession is a reimbursement. I think in an outcomes based model like EmpiRx's model, is there a place where we can reimburse pharmacies fairly and we can use pharmacists to drive interventions because employers will pay to engage a patient and help the patient into a better therapy and ensure adherence. EmpiRx is the example that employers see value in that and that they'll pay for that. But again, I think the environment where the big three control over 80% of the market, they still very much have people trained to that legacy model of rebates first.
Yeah, community pharmacies are literally being squeezed and pushed out of business. The National Association of Chain Drug Stores reported recently that more than 6,000 community pharmacies have shut their doors, gone out of business during the last 5 years alone. And that unfortunate trend is, if anything, picking up steam. It's not really abating. You just mentioned one of the big pharmacy chains that just went out of business. So it's a massive problem, and it's creating this new term now that we've just heard about called pharmacy deserts. They used to talk about food deserts where you have inner city neighborhoods that don't have grocery stores, and now we have probably an even bigger problem of pharmacy deserts across the U.S. Actually, the latest statistics show that nearly 50% of American counties now are pharmacy deserts, which means that it takes you, a couple of hours to get to your pharmacy and back. More than 85 miles for a round trip. So it's making it more and more difficult for people to get that trusted healthcare that they really rely on. One of the other big issues in terms of pharmacies going out of business, you mentioned the reimbursement rates and being pushed by the legacy PBMs, but those legacy PBMs, they own their own pharmacy networks as well. And that's one of the bigger problems, this issue of vertical integration, that really the biggest PBMs have become these massive vertically integrated behemoths as companies that have their tentacles in every business imaginable. And so they basically own both sides of the deal. They're a PBM and they're a health insurance company and they're a pharmacy chain as well, which is another thing that's really pushing community independent pharmacies out of business. Um, how would you comment on that? I mean, I know that you've been pushing hard for PBM reform that would prohibit that vertical integration. What do you think of where that's going today?
I think it's shameful, Patrick, that we've turned a blind eye to the simple conflict of interest. Like, how do you own a PBM and own the pharmacy as well? You now control end to end, the entire from you have the relationship, you've built the relationship with the employer, so you're managing their benefit. You own the company that's managing the benefit, so you set the price for the employer. You have your network pricing, you're setting that, and now you own the pharmacy too, and now you're managing that component of the pharmacy, right? And so it's a complete conflict of interest, and it shouldn't exist. I mean, I think the legislation that's been proposed, I hope to see it happen. Recently we had Arkansas push some legislation through, that shaked up a lot of people, and that was stopped now by the courts. I think that's still under review,
It
but I
is.
do think the right path forward is to break up these monopolies and stop these conflicts of interest. There's just not It's not good for the consumer. The consumer loses. If you don't believe me, to your point, look at the pharmacy deserts you're creating. Look at what's happening as a consequence to all of this. And what scares me, Patrick, is you use COVID as the example of where we leaned on pharmacists. It's not a matter of if there will be another event where we're going to need pharmacists to step up. It may not be at the scale of a pandemic, but prior to COVID, we had huge flu outbreaks, right? That pharmacists stepped up and helped us solve, by providing immunizations, right? Then COVID comes, and 4 or 5 years later, you have COVID coming. where we had to leverage them heavily. What's next? Again, it's not a matter of if there'll be another event where we'll need to lean on pharmacists. It's a matter of when we're going to need to lean on them, and we're going to regret creating these deserts, because we're going to need them and they're not going to be there for us. And that's really sad, because I don't know how you fill that hole. You don't have enough primary care. Now you've created pharmacy deserts because we've decided that we're not going to reimburse them correctly. Um, there's not a need for this, all because we're trying to fuel the greed of three, maybe five really large corporations.
And even after the example of how pharmacies and pharmacists stepped up during those really difficult days of the pandemic, the pharmacy industry is still fighting the battle in virtually every state to try to gain, true healthcare provider status, so they can provide more of those clinical services and get paid for them. So
That's right.
that's certainly a big cause, and it's one that we at EmpiRx Health are very supportive of. Let me go over to shift a moment to the leaders that you talk with all the time. So the leaders of the pharmacy industry that you're close with, and I know you have a lot of conversations with them about supporting and empowering the industry, what we can do to help them every step of the way. And in those conversations with pharmacy industry leaders, a lot of them that lead, significant pharmacy organizations that have grocery as well. Um, what are you hearing from them about what they need to do to not just survive but to thrive in this new era? And what are some of the challenges they have with their own in working with PBM companies to manage their own pharmacy benefits?
Yeah, I mean, a couple things I'd like to say is, one, I would say, when you think of pharmacy benefit management, that pharmacy component is very important. And when you look at all the PBMs that are out there, exception EmpiRx, because we staff many, many, many pharmacists, I think the question you should ask yourself if you're an employer or a broker looking to do business with a PBM is, I wonder how many pharmacists do you have? Like, how many you manage a pharmacy benefit? How do you do that if you don't staff pharmacists and clinicians to engage and partner to look at patient therapies? It's shocking, because the fact is most don't employ pharmacists at any scale. So how are you managing a pharmacy benefit when you don't have pharmacists or pharmacy techs employed, right?
It's a good question.
It's crazy to me. So that's kind of obvious. When we talk to the leaders, look, I've been in this profession my entire life, my entire career, right? Working in pharmacy. It was my first job. It'll be my last job working in this industry. Got a lot of good people out there that are trying so hard to drive change, and that change has really been kind of positioned to go and talk to go speak in Capitol Hill and try to get regulators and legislation around reform and paying pharmacists for more, and trying to get reimbursement aligned so that they can make more money or actually make money for services that they provide, because a lot of the services that pharmacists provide outside filling up prescriptions, they don't get paid for. So you don't get paid for all these services, and then you're being squeezed for prescriptions on some, it may be shocking to everybody, on some medications pharmacies lose money. Right? Can you imagine? You're
It's
filling a
incredible.
prescription, you own a pharmacy, you're filling a prescription, and you're going to lose money on filling that prescription, but you don't have a choice because you signed a contract, right? And if you don't fill that prescription, you be in violation of your contract, and the threat of losing many patients, right? And it's not, nobody wants to do anything that's not fair. That's not a fair agreement. But to answer your question, look, I think many of these leaders who are great people have worked very hard, and they go to Capitol Hill every year and they partner with organizations, to try to have a voice out there. But unfortunately, zero change, even through, I think everyone's hopes were high post COVID, thinking through, well, it's obvious that we did so much. Like, now reimbursement has to happen, and still nothing. Right. And so I don't think there's a lot that's going to happen through the regulatory channels, especially in the current state of what's happening in Washington, and both sides agreeing not to agree to anything. And so, what can you do as a leader today? I think look inside your organization. And this is shocking to me that the organizations that are abusing you on your network and squeezing your pharmacies are the same organizations you use for your personal benefits within your company. Start there. Start by not giving the big three, the big five, your business, right? Let's stop feeding the beast, right? Because a lot of these organizations that I'm talking about are big pharmacy chains with amazing leadership, right? That could actually put a dent in these guys, right? And say, you know what? I'm not going to give you my employees anymore. I'm going to try to engage in something different. And it starts with, what can I do at home? And so what you can do at home is not give them your benefit. Don't let them manage your pharmacy benefit, because they're not doing it. They're just letting things go, and it's costing your organization a lot of money. So if I'm leading a pharmacy organization today, I'm saying, hey, I want to see how much I'm spending on my benefit. I want to look for an alternative model that's pharmacy friendly, and that's where I want to move my benefit. And so, whether that's EmpiRx or another mid-market PBM, any move from the big five should be a welcome move. And you should pursue that if you're a pharmacy leader. Encourage you, of course, to look at an outcomes-based model, which is what EmpiRx is, so that we can use pharmacists to put patients on the right therapies.
Yeah, I mean those pharmacy leaders are listening, Danny. Actually, earlier this year, EmpiRx Health announced that Giant Eagle, which is a leading regional pharmacy and grocery chain with more than 200 pharmacies, had selected EmpiRx Health to be their new PBM company, providing pharmacy care services and solutions for their employees and patients, et cetera. Why do you think Giant Eagle, really a leader and innovator in pharmacy care and in grocery, why do you think they decided to kind of break out of the norm and choose mid-market EmpiRx Health to be their new PBM?
Yeah, I love Giant Eagle. Not just that we're partnering up on this mission, but over the years, Giant Eagle's not afraid to step in and try to evolve the profession forward. Like, if there's one chain that I would look at and say, these guys are willing to try something new.
They're
Giant Eagle,
innovators.
they're super innovators,
Yeah,
and they care about the patient. Like, if you go to the Northeast, and you're a Giant Eagle, you're a Giant Eagle consumer, you love Giant Eagle. Like,
yeah.
they know how to treat their, not just their patients, but their consumers, right. And there's a loyalty there, and there's so much trust within their patient population, and consumers in general. And I love that, because it just shows that they do put the customer first. I think they're very thoughtful in what they put out there. And so when we sat down and they saw the model, it was obvious that, hey, this is something that can, not just help our employees today, but it's something that we want to buy into for the future, right? So, Giant Eagle and that whole team, I would blanket label as luminaries, people who want to change and are tired of just the lack of change. At some point, Patrick, I think you got to you got to take it in your own hands and say, I'm tired of the status quo. I'm tired of showing up and relying on somebody else to sign a bill or put something forward. I'm going to drive change with what I have. And I think that's what the team of Giant Eagle has done. And I'm super excited with the work that we're doing together. I mean, we are actively evolving the pharmacy PBM space together, at a small scale. And we hope, as we bring on more pharmacy chains, and I hope leaders get excited to see what Giant Eagle has done and try to replicate some of that, we'll be able to kind of grow what we're doing, and hopefully, spin out new networks that reimburse properly and do innovative things across pharmacy, because, we'll have the reimbursement in place to do that.
Yeah. uh, they really have shown that you can take back control of your pharmacy care, of your pharmacy benefits, and control your own destiny, which is just incredibly important for the industry today. And that opportunity is there. So, one of the things that EmpiRx Health has done with Giant Eagle, and Giant Eagle has been a close partner with the company in this, is to launch a new pharmacy care network called AllyRx. And AllyRx, which was launched a few months ago, is the first national pharmacy care network specifically designed for pharmacy companies, pharmacy organizations like Giant Eagle and others that are actively working with EmpiRx Health to now join this network. Talk to us a little bit about what AllyRx means and what it does for pharmacy chains, and the importance of the technology that underpins what AllyRx can do for its pharmacy partners.
Yeah, AllyRx is the idea that you can bring enough volume together at a table and say, okay, we have enough pharmacy partners and chains together where we can create an environment that's pharmacy friendly. So network is the most obvious thing. If I can consolidate enough pharmacy chains to play together, can we then launch a pharmacy friendly network that reimburses these pharmacies at a fair click? Right. And so and then reimbursement extends just beyond medication, is also for therapies that we can run through the pharmacy benefit, right? And again, pay pharmacists for doing those things. The idea of LRX extends into, maybe one pharmacy chain offers a service that another doesn't. Can they benefit from working together at the table and say, there's food as medicine idea, right? Where I'm using, these frequent member cards, to know what a member's taking. Can I analyze that information and recommend things to members based on their drug therapies and the foods they should be eating? And maybe there's one chain that does that really well, another chain wants that solution, and now the LIRX is bringing that together and partnering. EmpiRx is in the middle of that, connecting the infrastructure, right, and being able to connect the dots across all of that and empowering the technology. The technology that we have today, is very unique in the space. Nobody has it, and what our technology does, our clinical technology does, is it serves our pharmacists, the patients that need interventions, but serves them not just adjudicated pharmacy claims. It's also serving them medical claims. It's ingesting lab information. So it's painting a complete picture for our pharmacists so that they can engage with the physician to have a discussion, about the patient. And I think that's really important, Patrick, because unfortunately, because of the practices of the big five, PBMs have been labeled, as these giants that have very tight networks that are steering, prescriptions to preferred drugs because they're more rebate. All these terrible things that PBMs do. EmpiRx is not that. EmpiRx is partnering with your physician to talk about the therapy that you're on, to make sure you're on the right therapy. And I like to compare it to an inpatient experience, right? When you go to the hospital, you have a care team. When my parents get sick, I'd send them to the hospital because I know that they're going to have a doctor, they're going to have all the resources, they're going to have a clinical pharmacist. Everybody's going to work together to get mom and pop on the right therapy and stabilize them. And they're going to walk out of there on the right drugs, right? That's the goal. And so we've replicated that in the outpatient space, where we've brought a PharmD forward to partner with your physician to make sure you're on the right medications. And as I said earlier, often your physician doesn't have a complete picture of what you're taking because doctors unfortunately aren't communicating well. We do, because we're your PBM. We can see every drug you're on, and now my pharmacists have the technology that I can see every drug you're on. I know your disease states from your medical side. I know your lab values from the lab side. And now I have a complete picture and I can go have a discussion with your doctor that maybe didn't know you were on XYZ drug, or maybe didn't realize that you were doing better and your labs look better. Now we can titrate you down on your dose so that you don't have so much side effect. So that's the vision of
Yeah.
what AllyRx is, and a little glimpse into the technologies that we use.
Yeah, it's very exciting. It's a great vision. And to your point, it is so dependent on innovative, proven technology. And that technology that we at EmpiRx Health provide to our clinical pharmacists is all based on the clinically platform. So that is EmpiRx Health's proprietary technology platform, which at its center, it has a proprietary population health engine, which really enables our pharmacists to truly understand the needs of the patients and really zero in on those patients that could benefit from even more care. So technology is critically important, but it really comes down to the pharmacists.
Isn't that
That
novel though, Patrick, right? A
it truly is.
PBM that employs pharmacists and that
Yeah,
has pharmacy software to look at pharmacy claims. So those pharmacists have work to do. Like that,
yeah.
geez, that sounds like what pharmacy benefits should be.
You're exactly right. As I said earlier, it's the radical idea of actually having pharmacists lead your PBM companies. So I think it's an exciting change in the industry. Let me ask one more question, just to wrap things up. The Wall Street Journal just published a major article that reported on two of the leading benefits companies in the U.S. Just released major new studies which showed that American businesses, large, medium, and small, are dealing with a just exploding healthcare costs. So the healthcare costs are rising at a faster rate than they've seen in more than 15 years, according to this study. So, what we knew is a big problem of rising healthcare costs, which is largely driven by the rise of specialty drugs and other branded medications. That problem has only grown and exacerbated. Companies of all types and sizes are facing just a huge problem to deal with, providing and paying for the critical health care for their employees. Uh, what would you say to those companies today of what they can do? The companies that sponsor health and benefits plans and pharmacy plans. What would you say to them that they can do today to reduce those costs and manage those plans at the same time keep their employees healthy and productive?
Yeah, well, you hit on it a little bit, and so if you're out there and you're looking for the right benefit and you're worried about these continued rising costs, is one, recognize that that's not going to stop, right? The drugs that are being developed are more expensive drugs. They're specialty medications. Basically, everything that pharma is working on are specialty medications that are on average over $300,000 a year. So that machine is a very well-funded, well-tuned machine that will continue to push drugs to consumers. And think about that a little bit. Think about the commercials that you sometimes see on TV about, this drug has come out for this, and you see the person running through the fields, and this drug isn't just going to solve your psoriasis, it's going to help your marriage, it's going to do all these wonderful things. Consumers walk away with that, they go ask their doctor for that, don't realize that yes, that's probably going to solve your psoriasis, it's also a $300,000 drug. You don't need that drug. You may need a generic drug that's been out for a long time. So my point is, you're not going to stop pharma from doing what they do. They're very good at it. They will continue to do what they do. So note that, employer. The other piece to note is you have a lot of PBMs out there that are touting transparency. I'm going to look, the way you solve the big three problem is by being transparent on your benefits, passing through, your rebates and all these things. And while that is helpful, that absolutely is helpful, that you don't have the greed of the big three taking away, component of rebates and taking away or creating arbitrage, you're eliminating some of that arbitrage. It doesn't solve the problem that what's driving your costs, and this is the key. If you're an employer and you're out there, look at your drug mix, look at your claims from last year, and look at how much is driven by specialty spend. And what you're going to realize is about 10% of your population is driving 70% of your spend, and it's specialty. They're specialty drugs. This is what you need to focus on. And you need a PBM that is equipped and able to engage physicians, on this topic, right? To say, why is Danny being prescribed a $300,000 specialty medication when a $10 generic is just as good for the ailment or the condition that Danny has? That's so the problem. So in summary, the problem to fix is specialty prescribing. The only PBM out there that's attacking specialty prescribing is EmpiRx. Why is that? Because specialty meds are very rebate rich medications, right? And so every other PBM out there wants you to take more specialty medication because that's how they line their pockets. In the EmpiRx model, It's not about specialty prescribing. It's about getting patients to the right therapy, and we share in that savings. Um, and so that's what I would say to anybody that's out there looking, or brokers that are looking for a differentiated model that puts the patient first. You know, Empirics drives that model, which is, hey, let's be transparent. Sure, that's table stakes for any mid-market PBM these days, but can you put patients on the right therapy and curb specialty prescribing? That's what's really driving up the spend.
Yeah, I think that summarizes it perfectly, Danny, and that's a great prescription for plan sponsors and employers to lower the costs and at the same time ensure the health and well-being of their employees. We want to thank Danny Sanchez, the CEO of EmpiRx Health, for being our great guest at our first podcast. Thank you so much, Danny. We really appreciate it. And we know you have a big year ahead of you. So I know you're excited about the year ahead and beyond.
Thank you, Patrick. Appreciate you having me.
Thank you.
Cheers.